Hello all, this is Dr. Alsup and welcome to Station 16, and I am ever so sad because we are on the last video about bones, or the bones of the ankle and the foot. So even though this is the last specific one in terms of bones, of course we'll talk about them with joints, so I shouldn't be too sad. Okay, so now we are looking at a superior view of both the ankle region as well as the foot. And these bones that are shaded in different colors are going to be your tarsal bones. Recall that we have 7 tarsal bones per foot. You only have to be able to identify the 2 largest ones. So the one shaded in purple here, the more superior one, is the talus or the talus. You'll hear it either way. This is the bone that's going to articulate with the tibia and the fibula, as well as an inferior articulation with the calcaneus, which is this bone shaded here in light orange. So the calcaneus is your largest tarsal bone. It is inferiorly placed, and a lot of times we colloquially refer to this bone as the heel bone. And you can see it has this really robust posterior portion because this is where you have that attachment of that super large calcaneal or Achilles tendon. And just for fun, just because they are here, even though you do not have to identify them, this is going to be the navicular, this is the cuboid, and these are the 3 cuneiforms. They are named 1, 2, and 3 from medial to lateral, or sometimes you hear them referred to as the medial, middle, and lateral cuneiforms. So those are the other tarsal bones. I wanted to at least put them out there, but these are the only 2 that you would have to identify in a practical setting. Okay, the bones here that are shaded in light orange are going to be your metatarsals, and these are numbered 1 through 5, with number 1 being the kind of the stoutest and the shortest, and it is actually going to be medial. And this will be lateral, so it'll be numbered from medial to lateral 1 through 5, which is not what we had in the hand. If you recall, the first digit was the most lateral digit that was associated with the thumb, whereas the first digit in the foot is going to be associated with the great toe or the big toe, which is medial. And then you have the phalanges here in light pink. You will have your 5 proximal phalanges. Then in this kind of light purple color, you will have the 4 intermediate or middle phalanges. You do not have an intermediate phalange between the proximal and distal phalanges of the first digit. And then these light blue are going to be the 5 distal phalanges. And you can see that these middle and distal phalanges become quite small, particularly when we're looking over here in the 5th digit. So it can be difficult to identify, particularly in a disarticulated skeleton. All right, so those are the last bones that we are going to discuss. We will put some of these bones together in terms of talking through the joints of the lower limb and starting with the next station. So thanks for your time and attention, and reach out with any questions.